Listen, my mouth cannot explain properly what I saw this morning at the hospital. Next thing, the two girls that were waiting for their result, they didn't give them their result. Now, the doctor wants to see them. Omo, now so they opened their result. The main thing is that the two of them are carrier of hepatitis B. Guy, hey.
Do you know that for me, I can tell you for free that in the past 2 to 3 years, before I can count one HIV patient, I have at least counted seeing 5 to 10 women who have been infected with hepatitis B. And to me, this is really very concerning because we talk less about this. And it is even more surprising that some of these women who are found to be positive, they get to find out when they come for booking tests during pregnancy, or they are being booked for a surgery, and then they are found to be hepatitis B positive. So that means that they have had this chronic infection and they never knew. Hepatitis B virus can be transmitted in similar way, just like HIV, through sexual contact, through blood contact, blood transfusion, and so on. And definitely would not give you any symptoms initially, until in the long run, this can affect your liver, causing severe liver disease called cirrhosis, or even liver cancer. And it's not just about you. A pregnant woman who is infected with hepatitis can infect her baby through vertical transmission, either through pregnancy, labor, or delivery. And not just about the baby. If your partner is not aware, not tested, and not vaccinated, he also stands the risk of being infected because there can likely be an ongoing transmission. And so it doesn't stop with a woman going to have a test done and you find out that you're negative and you say thank God and you go home. No, it doesn't stop there. That you're negative does not necessarily mean that you are protected, and it doesn't mean that you cannot get infected again. So the only way you can be protected is if you get vaccinated. And unfortunately, if you test positive, please find a safe way to inform your partner so that he can get tested, and if he's negative, he can get vaccinated. That is the only way you can protect him, since this is actually sexually transmitted. And for you, you should be able to see your doctors, your hepatologist or your gastroenterologist. The good news is that you can be vaccinated if you test negative. And in that way, the body would find a way to train your system to fight the virus so that you don't get infected. You only need 3 doses and it confers long-term immunity for at least 20 to 30 years or even more. A quick note for me, even as a doctor, even though I've been vaccinated and encountering quite some number of patients who are infected with hepatitis B, I actually had to test myself a few months ago. Thankfully, when I saw the result was negative, I had peace of mind. So don't assume, just go and get yourself tested. Because queens don't gamble with their health. We try to guard it as much as possible. See you in another video.